I just marched through these big doors at Hopkins and said, "Hi, I'm here. This is where like you do that, right?" And they said, "What?" And I said, "Well, fix up somebody's like genitalia." And they said, "Oh, well, it's actually this whole big process."
I would go to places to try to get help, and I wasn't getting any help. Well, I remember one psychiatrist set me down, looked at me, and he said, "You are going to live a very pathetic life." So at that point, I trusted nothing that had MD behind it at all.
They said, "Mr. Davis, you don't understand. You're not a patient here. We don't treat transgender people. You'll have to go elsewhere because having a sinus infection as a transgender person is too technical, too difficult for us to handle."
My health insurance offered through my employer suddenly became useless to me. Once I started transition, the insurance company thought I was male, but I had a female body. If you went across a line, suddenly your claim was thrown out.
It was lonely in those early years. It was hard to find any resources. It took pushing pretty hard on doors.
What I've experienced most in healthcare from other people all the way along has been the need to educate every doctor I see. They just haven't had the training for it, and they still aren't getting a whole lot now.
A question would be, this child is so young, is it possible for them to know their gender identity? Is quite different than saying, oh, they're too young to know who they are, therefore, no action, no movement, no whatever. Let's just step into those questions. Let's not make them statements.
We know it's safe, we know it's effective, we know people rarely regret their decisions, less than 1%. It's not the norm. You don't formulate a policy based on case reports of bad outcomes. You learn from case reports and you modify your hypotheses and maybe your protocols, but you don't end programs that are clearly successful.
My classmates of 140 know me. They know that I'm trans. They know that I'm an older guy. They accept me. Life is good.
I have often been approached at conferences by a young person. They'll come up to me and say, "Oh, I am so glad to meet you. It makes me happy to know that I can live to be old and have a decent life."
I think we were sorely lacking role models, healthy role models. We were sorely lacking people that we could look to and say, "You mean I can be okay? I have permission to be happy?"
I teach students, medical students at Stanford University, how to work with people like me, how to not be put off by bodies like mine. If I can have one medical student who says, "Thank you for teaching me this, and when I do have my first actual trans patient, I'm going to remember what you taught me, and I'm going to treat that person with the respect that they deserve." What more could I ask for?